And welcome back to the Family Medicine Rocks podcast. My name is Mike Savella, FamilyMedicineRocks.com. So just a couple of stories I wanted to share with you here. One that is all over the FM Revolution hashtag is something that the American Academy of Family Physicians is doing. They are partnering with the Centers of Disease Control, the CDC. And there's an article about it yesterday, May 22. From our good friend, the president of the American Academy of Family Physicians, Dr. Jeff Kane. The title is AAFP Join CDC Campaign Urging Smokers to Talk with Your Doctor. The AAFP joined the CDC director, Dr. Thomas Frieden, and the U.S. Surgeon General, Dr. Regina Benjamin, in Washington to announce a new component of the agent's Tips from Former Smokers campaign that will encourage smokers to talk with your doctor about quitting. Last spring, the CDC ran a 3-month national tobacco education campaign featuring former smokers telling their own powerful stories about their horrors smoking inflicted upon their bodies, heart attack, stroke, cancer, and more. In late March, the CDC rebooted the campaign with new stories from former smokers suffering from a different array of health problems. No doubt, you've seen or heard these advertisements that have appeared on television, radio, billboards, and buses, as well as in magazines and movie theaters. The tales are grim and hard to forget, but there's also the reality of tobacco use. Tobacco remains the number one source of preventable death and disease in our country. This month, the CDC will begin running new television ads to encourage smokers to partner with their physicians. The ads feature the tagline, "You can quit. Talk with your doctor for help." So are you ready to help? During last year's campaign, call volume to 1-800-QUIT NOW more than doubled. Imagine how many more people can be helped with a high-profile reminder that physicians are a great resource for smoking cessation. 70% of smokers say they want to quit, but only 1 in 10 will manage to stop on his or her own. And they're in our offices every day. Smoking cessation is one of the most simple, cost-effective interventions we can offer, and the brief conversation can save lives. If you are looking for resources for your office and your patients, the Academy can help. The AAFP Ask and Act program offers dozens of free resources, including including a practice manual for creating. I just messed this all up. The AAFP, take two. The AAFP's Ask and Act program offers dozens of free resources, including a practice manual for treating tobacco dependence, coding information for cessation counseling, a pharmacologic product guide, and a stop smoking guide for patients. The CDC's webpage related to this initiative also has free resources for physicians. Talking to our patients about tobacco cessation is one of the most important and proven things we can do for their health. Will you be ready when your patients who smoke ask to talk with their doctor? So there's more information on AAFP.org. And big shout out to our good friend, Dr. Jeff Kane, the president of AAFP. Check out his blog post at the Leader Voices blog. The title is AAFP Join CDC Campaign Urging Smokers to Talk with Your Doctor, dated May 22, 2013.